the overcrowding sits in a particular context, and that context is very important because it magnifies the impacts of the overcrowding and the growth of the population. Let me go through some that I think are important. First is the climate in which any discussion of corrections takes place here in New South Wales. It's one where sound science is absolutely crowded out by sound bites, and you know what I'm talking about. Corrective service budget pressures and savings targets. We now, as a result of that, when you've got 70% of your budget is consumed in staff costs, you have to save in staff, so you have inmates still being locked down at 2 o'clock or 3:30 in the afternoon and on weekends. There are significant legacy failings over many years which are now impacting on the department's ability to respond to the pressures combined and individually. These include inadequate bed space and the dysfunctional distribution geographically of the bed space. And this is solely a product of earlier estate planning or lack of. Then extensive inmate accommodation now in 19th century facilities, more in New South Wales than anywhere else in Australia. A significant number of facilities were assessed by corrective services as, quote, not effectively contributing to business objectives, and that's just consultant speak for obsolete or unfit for purpose. Lack of access to work education activities and other programs, lack of access to the ovals, to gyms and libraries, as officer posts are stripped. Long waiting times for access to health services, limitation on visit time, shortages of clothing, and incarceration beyond possible earliest release dates.
The reality is that the department at the moment is having to move people. If they don't have a court appearance within a 2-week period, they're having to move them out and then bring them back. The previous estate planning was just left the agency with the wrong beds in the wrong place, the wrong classification beds to match the inmates.
The overcrowding, though, the rising capacity is leading to all sorts of other issues, because it's not only becoming unsafer with the doubling up and tripling up of prisoners into single cells, but it also is leading to other issues. There's a propensity for violence against prisoners in private prisons because of the reduced staffing in those prisons, and private prisons to drive for profit rather than to drive for the purpose of rehabilitation, reduced staffing, and that leads to a more violent environment, and we've seen aspects of that all over, not just Australia, but all over the world.
I want to say on behalf of the Community Justice Coalition that we are opposed to privatising of prisons. Prisons should not be there for the making of a profit.
This report from the Inspector of Custodial Services should have been a comprehensive wake-up call to politicians in this state. Whilst we've had an expanding prison population on one hand, we've had a reduction in health services, a reduction in education services, and a reduction in work opportunities, and an absolute reduction in those opportunities, while there's been an absolute increase in the prison population on the other side. I hear Luke, the Assistant Commissioner, come in and saying we have the most efficient prison system in the country because we spend least per prisoner per day. Well, I don't think that's a mark of efficiency at all. In fact, there's no evidence that just spending less per prisoner per day is an efficiency marker at all. All it says is we spend the least per prisoner per day. There's no evidence that we're achieving any positive outcomes out of our spending. And if that's the measure of efficiency, well then I think we're in an enormous difficulty. The measure of an efficient prison system, one would think, is the capacity to which the prison system, the correctional system, reduces recidivism.
My name is Joy Gardner. My son is incarcerated at Lithgow Prison. He has been held in a closed unit. 2 years ago he tried to hang himself in that same unit. They sent him to the hospital in Sydney. I wasn't notified by the jail, so there was no duty of care from the jail. and I didn't find out for 4 days after he'd been put in the hospital. Of course, the hospital rang me and said I could come and visit him, and I didn't even know he'd been moved. He's had no education, there's no counselling for him. He's into his parole period, which he should have been released in June this year. He never had a hearing for the parole, and he's just in this sealed unit where at the moment they have no TVs, nothing. They've been taking everything off him because one other inmate acted up, so they've taken the whole lot off all of them. He's been incarcerated, he's 35, he's been incarcerated on and off since he was 14, and he has had no help whatsoever to be in a community.
I just wanted to maybe comment on a couple of the things that have been said. First of all, Corrective Services hasn't disregarded John Padgett's report. There would have been 80 people in triple up beds across the whole state. So it exaggerates the situation to assume that we're tripling up people in those beds. Of those 80 beds, with the exception of 5 of them, the people were only in there for a short term. So in terms of non-compliance or any issues of compliance, they moved within 28 days. And as I said, that's not desirable, but it isn't. The problem isn't exactly as has been described, I think, here. So the strategies for increasing the space have included reopening closed facilities, and Steve mentioned Kirkconnell being closed. We've reopened Kirkconnell. We've taken Carryong back from juvenile justice, and single events can cause that to happen, where there becomes a sort of a corrosion in people's confidence in justice processes. You have a case like the Jill Marr case, the Leary case in New South Wales that followed on shortly after, and people get tougher on parole. Or you have an issue like the Martin Place siege, where people are concerned about bail. The population took off almost directly on the day of the Martin Place siege in terms of the number of people in remand. The population went off there and exceeded all projections. So it's quite hard when you don't have a buffer, which Corrective Services doesn't have, to respond to that. And some of the responses we've had to put in place are far from satisfactory, but there is a long-term plan to address some of that by building capacity. John mentioned the jail at Parklea being expanded. There's also a plan to build 600 beds in graft junctions of demand, a growing population in that region. We need a jail up in that place. It's the place where we've had to turn the police away when they've wanted to hand people over to our custody on various occasions because the availability of beds in that area is so small. So they're there because there's a demand for those beds because people live there and not for any other reason.
Just tell us on the changes at Parklea and Grafton, what's the timeline you're predicting?
5 years' time for those to be delivered. But in between that time and now, we're going to have to bring on board a lot of other beds. 1,000 to 2,000 more beds will have to come on before those ones come online. The fact is that there is no science behind the existing public health regulation. Public health regulation at the moment requires every inmate to have 5.5 square metres of space if they're going to be in that space, sleeping accommodation for more than 28 days. It came from regulations that were created perhaps for boarding houses and other circumstances, and we've been trying to understand what does it mean if they've got 4 square metres or if they've got 6 square metres. Is there any protection conferred on people to their mental health or otherwise? We've engaged an independent body of people, the Kirby Institute at the University of New South Wales, to review the literature. We've got Justice Health doing surveillance on all cells, and we've got Denise here who's been involved in that project, looking at all cells where people are sharing accommodation that is less than compliant with smaller spaces to see is there any difference. And I think at the moment there's not much evidence that there is any difference. Just around this issue of the availability of programs, and it's been pointed out, which is quite true, that there is a certain amount of resource being spent on the programs. I used to run the programs area for some time, and in the time that I was there we significantly expanded program provision year after year. However, the people that we have in our care have enormous needs, and it'd be very unlikely that anyone could afford to meet all of those needs adequately. So there's systems in place for prioritising. John mentioned that we're trying to make our programs more effective by having a more streamlined approach. So we're introducing a suite of programs called the EQUIPS programs, where you build one module upon the other to address things more comprehensively. And I've just seen our latest performance report on program participation. We're showing good improvements across the board on increases in program participation in sex and violence programs. High-risk sex and violence programs are the most expensive ones we run because they involve people being in treatment, say, for 9 to 12 months, and there's a shortage of those resources. It might take 2 facilitators with 10 offenders over 9 months to actually get the sort of results we want, and they're in short demand, but the numbers in those areas are increasing as well. So we're trying to increase those programs.
Quite obvious that the vast expansion of the number of prisoners and overcrowding must make it harder to meet the proper objectives of the prison system. That is to say, in accordance with our international obligations, reformation and rehabilitation.